One tiles for your home, I see. Bathroom, kitchen, pantry. Need tiles for your balcony. Come down to Tiles Plus, satisfaction guarantee. Tiles Plus, Tiles Plus, Tiles Plus. Big tiles with unbeatable cost. Customer service, A plus. This all kind of tiles. Come down to Tiles Plus. We also got gasware and vanity. Doors, you'll see. Come down to my nobody. We got the best tiles on island. Trust me. We are located Land Street in Castries, Bosses Grocery Lanes, and Flag Street in Beaufort. Telephone number 453-7939. Tiles Plus.
Serving now, the Daily Dish.
In terms of this rollout, this opening, I'm so very pleased. And welcome to the program, and we hope that you guys are able to share with us all that is happening with respect to this Castries Urban Polyclinic. Welcome to the program.
Thank you.
Thank you.
Now, we've been hearing about this transition to become a polyclinic for what was formerly Victoria Hospital for some time. Of course, as OKEU has now opened up, and the refurbishment of the facility to be able to provide services for the people of the Castries Basin and further afield. Where are things at, Dr. Joseph, in respect of this Castries Urban Polyclinic?
Thank you for such a valuable question, so that we can take this opportunity to really share with the public the progress that we have made at the Ministry of Health, Wellness and Elderly Affairs in terms of restoring services in the Castries Basin. As you have indicated, the Victoria Hospital has been around for quite a long time, as you indicated, 1887, and it has really served the populace of St. Lucia. And, we come a point where the services at the Victoria Hospital was transitioned over to the Owen King European Hospital, that now become the Millennium Heights Medical Complex within the services they provided. Now, as we move forward to re-establish services within the Castries Basin in the primary care services, we sought through several directions to move towards the former Victoria Hospital to establish those services. It offers us the right infrastructure to allow us to expand the service we can deliver in this in Castries. And as such, as you have indicated, the former Victoria Hospital is now being renamed as the Dr. Winston C. Paris Medical Complex. Being a complex, meaning that there are several services that are going to be provided under that umbrella. And as such, we do have a component for the Millennium Heights, which we call the Millennium Heights Secondary Care Hospital. And now we are establishing, or have established, the primary care section of the facility that is of Dr. Winston C. Paris Medical Complex under the name Dr. Betty Wells Urban Polyclinic. I do note you have indicated the Castries Urban Polyclinic. Yes, it was a name that we were looking at in the earlier phases of our development. But now that we have concluded is that our urban polyclinic will be the Dr. Betty Wells Urban Polyclinic. And this is what we will be working with now and in the future. To note that we have been undertaking a phased approach in the rollout of services under the Dr. Betty Wells Urban Polyclinic. On December the 2nd, just recently, we have started the services of the National Eye Clinic. I recognize you did mention the Cuban Eye Clinic, but you will recognize also that we have a package of services that includes the Cuban Eye Clinic, as well as what we have known as the Diabetic Retinopathy Clinic. So both of these services will be under the common umbrella of the National Eye Clinic. I must say that we will not be losing our Cuban Eye Clinic name, as when persons visit the facility and seeing the National Eye Clinic, they will have an opportunity to see also the name of the Cuban Eye Clinic and the diabetic retinopathy that will guide them into these various services. In addition to the National Eye Clinic, in this first phase that is occurring in December 2024, we will be having a general medical clinic. We would know that at the Castries Wellness Center, the former Castries Wellness Center on Chose Road, we have had daily medical clinics Monday through Saturday. And because of the need for closure, this clinic was redirected to the Leclerc Wellness Center. And as such, in this phase, the General Medical Clinic will now be redirected from the Cleary to the Dr. Betty Wells Urban Polyclinic in the first phase. We will also transition the Diabetic and Hypertension Clinic to Dr. Betty Wells. And of great significance, in the primary care setting, we will establish an urgent care service at Dr. Betty Wells. Here, we do note that currently at the Millennium Heights Medical Complex, the emergency room, many patients access care that should really be seen in the primary care services. About 75% of those patients are really urgent, less urgent, or non-urgent. And as such, when all of these persons go to the emergency room at OKEU or the Millennium Heights Medical Complex, it means that there is a greater wait time for the less urgent cases. And with the establishment of this urgent care services at Dr. Betty Wells, we anticipate that these patients will access such services at the primary care and not going to the hospital, allowing the hospital to focus on the immediate and emergency cases. We will also be having pharmacy services at this new location. So persons accessing the National Eye Clinic, the medical clinics, diabetic, hypertensive, and even persons coming in, walk in from other wellness centers will have access to the pharmacy services at this facility. It is important to note that accessing the services means need for transportation, and the Ministry of Health would have engaged the Minibus Association to ensure that they strengthen the transportation services along that hospital road to allow persons to access these services that will now be established there. Another thing I want to point out at this point is that come December the 2nd, we will have the official opening of the urgent care facility that Dr. Betty Wells, that includes, as mentioned, the National Eye Clinic, the urgent care, the diabetic and hypertensive, the pharmacy services, among others. And by the 16th, we are hoping to ensure that the medical clinic, diabetic, hypertensive, and urgent care will be up and running for persons to access. As indicated, this is a phased approach, and those are the package, or this is a package of services that will be available in December in this first phase.
So, of course, the traditional Castries Health Center, Castries Wellness Center on Chaussee Road is no more. The services regarding primary healthcare, they are now to be received at the Dr. Betty Wells Urban Polyclinic, formerly Victoria Hospital. And you mentioning, of course, some very interesting add-ons, and certainly in terms of the access, because of course it's no longer just a health center. We're talking about a polyclinic, and we're talking about services above and beyond what you would get at the average health center. And of course, in the Castries Basin, you would well expect that. You mentioned urgent care services, and you made a very interesting point about 3/4 of the people who head across to the A&E department at OKEU are actually not really acute patients. They can, in fact, theoretically head to the Dr. Betty Wells Urban Polyclinic to get services. One important point, though, which I haven't heard you mention yet, what is the time of service that we're talking about? Is it still going to be the same? Is it going to be Monday to Friday, 8 to 4? Or are we talking about expanded services or 24-hour services? Give us a sense about that.
Very good question, because the public would like to know what time they can access these services. With regards to the National Eye Clinic, again encompassing the Cuban Eye Clinic and the diabetic retinopathy, these services will be available Monday to Friday from 8 a.m. to 4 p.m. in the afternoon. With the expansion and inclusion of the general medical clinic, diabetic and hypertensive, and urgent care services, these services will be available daily, inclusive of Saturdays, holidays, and Sunday. In addition, the hours of opening will be, in this phase, 8 a.m. to midnight. So persons will have a greater time frame at which they can access services. So usually at the Castries Wellness Centers, it would have been operational from 8 to 4:30. Here you have in 8 to midnight. So persons after leaving work, depending on the need, can access services, not only for the urgent care section, but the general medical clinic. The thing is, we really are trying to transform the culture or the behavior of health-seeking behavior in St. Lucia, whereby persons not only access services when they are ill. You want to do a wellness check, you have the option to attend to any of the wellness centers, inclusive of the Dr. Betty Wells Urban Polyclinic. And as such, providing services beyond 4 would allow persons who are working to access those services.
And of course, that's really important because, I mean, people's work patterns have changed tremendously. You've got lots of people who may be working until 5, 6, 7 o'clock, 8 o'clock, and they would not normally be able to access the traditional primary care service. And this is actually, in fact, allowing them, especially if you have a sort of an emergency at home, you could actually head to the polyclinic. I think right now, of course, you offer a similar service at the Grosley Polyclinic. You go up until 12 o'clock.
Yes.
And so it'll be a similar arrangement.
A similar arrangement, and inclusive of which I need to also indicate diagnostic services, x-rays, laboratory access. We are putting the mechanisms in place to ensure the delivery of those services so that persons can really benefit when they get to the facility as a one-stop shop. By the time we get to the real outcome of what we are looking at and the real package, where you go for one service, you go to maternal child health and you can access the lab. You go to the eye clinic, and if there is need for a certain test, you can go to the lab. You go to urgent care, there is need for an x-ray, you can access the x-ray services. But some of the other services will be add on in the second phase of our rollout of the Dr. Betty Wells.
And we'll get to that perhaps in just a bit, Dr. Joseph. Nurse Julietta, perhaps you could give us some sense as to urgent care. Who should be going to this urgent care facility at the Dr. Betty Wells Urban Polyclinic? Give us a little bit of a triage to break it down for us, as to because that'll be no doubt on many people's minds. Should I go to OKEU directly, or should I just go to the Dr. Betty Wells Urban Polyclinic instead?
Yes, that's a bit of a tricky question in terms of who should go, because not until one is really assessed that one may know exactly should they be at polyclinic or should they be at the Millennium Heights. However, like Dr. Joseph mentioned, there are primary care services that are offered in terms of I may have abrasion, I may have I want to be careful how I say it, because like I indicated, you may have a tummy ache and go to the facility. Yes, you'll be seen, but there will be a necessary referral if it is something more serious, more serious, that you would be referred to OKEU. But it's really a point where if persons are not feeling well, yes, and they feel that they need medical attention, that they need to access care at the urban polyclinic. If, like I said, if further more advanced medical care is required, then they would be referred to the hospital. So in terms of
I've fallen and I have a sprained ankle.
Right. So Dr. Right. So
those types of things.
Right. You can access care there. So in terms of you said you fall and you probably sprain your ankle. Yes, you can access care at the facility. And like Dr. Joseph said, once the extra services are in place, then you are able to get an x-ray to get the extent as to what type of fracture you may have that requires management. But generally, what we want to encourage is for persons to access the care, right, in terms of wound management, wound care, the basic ailments that you may have, that you access care at the polyclinic. And the urgent care will be equipped with all of the necessary equipment. So even if you're not sure where you need to go, once you access care at the urgent care facility at Betty Wells Urban Polyclinic, then after assessment, then you'll be guided in necessary referrals. But we really want persons to really encourage, like Dr. Joseph indicated, encourage accessing the care at the polyclinic.
So this is really should be your first port of call.
Exactly.
Maybe doing the diagnosis. If necessary, you may be referred.
Exactly.
Dr. Joseph, you wanted to step in?
Yeah. Thank you, Nurse Cassius, for your valuable input into the persons who should be accessing the Dr. Betty Wells Urban Polyclinic. We do note that for those who would have gone to the Grosley Polyclinic, the Soufriere Hospital, the Dennery Hospital, where they do have that urgent care section. It will be operated under a similar framework, whereby definitely if someone is having a severe distress and there is need for immediate intervention, uh, there is need for those persons, for instance, significant shortness of breath. A person is having chest pain. Um, you're hypertensive, you're having weakness on any particular side of the body, or if you find that you're having some alteration in your level of consciousness, you're having seizures, those are things that, you need to go to the hospital immediately to have that immediate or urgent intervention within that short time frame, within 15 minutes, 30 minutes. However, if, for instance, as indicated, a cough, what seems to be a cough and a cold, a sprain, not a major bone that is broken, you have a sprain, or you have a simple rash, um, fever. These are things that can come in to the urgent care. Of course, once you get to the urgent care, you will be triaged by the nurse. You're going to be given a score, and we will utilize this score in guiding patients into whether they go to the medical component of the facility or they go to the urgent care, because the way we're establishing this is that while we have the general medical clinics where the non-urgent, less urgent persons can be attended to, we have the urgent care that we can quickly transfer those persons who are classified as, let's say, even though I know the general public may not appreciate uh, the score of 3 of urgency, then those persons will be transferred into the urgent care. And with this, with our management, we have a system in place to allow us to transfer persons from the Dr. Betty Wells Urban Polyclinic to the emergency room at OKEU, just like we are doing at the Grosley Polyclinic, because you may very well find that while somebody may have a chest pain, shortness of breath, they may very well decide, you know what, I'm going to stop short at the Urban Polyclinic. And as such, we have capable doctors to stabilize those patients, assess and stabilize, and then to transfer over to the emergency room at the Owen King European Hospital.
So, of course, lots of different services, lots of different pathways that one might end up taking. But a good practice, you would say, is that the speed at which you may end up getting seen and attended to may very well be better if you actually go to the Dr. Betty Wells Urban Polyclinic in the first instance.
But I wouldn't say just the speed at which you go, because we do not want to give the general public that sense that, okay, I'm having a chest pain, it may be very, very well be significant, and so I'm going to stop at Dr. Betty Wells, or someone who is having a significant shortness of breath or tightness in the chest to stop by. Yes, we encourage persons who have significant signs or significant symptoms, of course, that are more critical, based on significant shortness of breath, chest pain. If you are having alteration in your level of consciousness or confused, if you're having like seizures, significant asthma or asthmatics, yes, because I must say that while I did mention severe asthma crisis, at the Dr. Betty Wells Urban Polyclinic, we will be having an area to manage asthma cases. And of course, if there is need for those persons to be transferred over to the Owen King European Hospital for further management, we will do so. I note while we are having this conversation now, we will have ongoing sensitization, to inform the public how best to utilize these services. So this is not just a one-on, but we'll have ongoing engagement with the public, utilizing your media and other media.
It also sounds maybe that the Ministry of Health may have to consider having a sort of a sort of a call center service, maybe. I don't know how you may want to call it, like a telephone triage, advising if somebody wants to know, where should I go? This is the situation. Sometimes people will call their doctor if they have a direct relationship with their family medical doctor, but not everybody has that, perhaps, and they don't necessarily have somebody to call to guide them. So just a thought.
Yes, very, very good.
You
Because we do have our triage area, and this is something we can look to integrate into our system to better manage the patients who are accessing the services, because patients may not know exactly then where should I go, because a lot of persons would have the impression that, okay, this was Victoria Hospital. Yes, it is Dr. Winston Paris Medical Complex, and yes, there is Millennium Heights Secondary Care Hospital.
Right.
And so they would quickly gravitate and say, well, despite of what I have, especially if I'm hearing that, the services there is fast and, it's good, which we will deliver, that they would want to stop. But it's not a case whereby we see patients there and admit directly onto the hospital component in the complex, right? As I said, that is being managed through the Millennium Heights Medical Complex. So any referral will have to refer to the OKEU, and as such, then we'll be able to manage who will be, and OKEU will determine as to who is going to be within that complex. So it's not to say, well, okay, I'm coming to the former Victoria Hospital, I'm going to be seen, and then I'll be admitted at the facility. No, we are an urban polyclinic, and we anticipate and we expect to be an urban polyclinic second to none.
Rather very interesting, because I was actually just about to ask you about the flows, and if in fact somebody could be directly admitted from the urban polyclinic into the secondary care facility that you have here. But it sounds, from what you're saying, not necessarily the case.
No, at this point,
that's not how it's
no.
gonna
Maybe
operate.
in future, when we further streamline the process, it may very well happen. But at this point, no.
Okay. Now, we're going to have to stick a pin at this point, in fact, because we're due to take in our weather report. So we're going to do this at this time. That's been our dish of the day. We'll be right back. Of course, we're speaking to Dr. Glensford Joseph, Medical Health Officer at the Ministry of Health, Ministry of Health, Wellness, and Elderly Affairs, as well as Principal Nursing Officer, Mrs. Julietta Frederick Cassius, of the Ministry of Health as well. We'll be right back.
This has been The Daily Dish.
One tiles for your home, I see. Bathroom, kitchen, pantry. Need tiles for your balcony. Come down to Tiles Plus, satisfaction guarantee. Tiles Plus, Tiles Plus, Tiles Plus. Big tiles with unbeatable cost. Customer service, A+. This all kind of tiles. Come down to Tiles Plus. We also got gasway and vanity. Books, doors, you'll see. Come down to my nobody. We got the best tiles on island. Trust me. We are located Land Street in Castries, Bosses Juguruzi Lakes, and Flag Street in Viewport. Telephone number 453-7939.
Michael, where you going with all that speed?
Girl, I hear Allen Style have a big Christmas sale, up to 50% off on all kind of tiles. Wall tiles, hexagon, subway, mosaics, and wood look tiles like you will see on HGTV.
You serious? I see they have a lot of new products too, like vinyl flooring, wall panels, ceiling tiles, even travertine to make your pool look top notch. That on sale too?
Yes, girl, it's everything store wide. I see they have got cleaners and sealers too. Tell me, BSL, I need those for sure.
Hey, girl, that's not a biggie, but we heading to Island Style right now.
Visit Island Style Talent Bath now in Castries, Rodney Bay, and Viewport. Find us on social media or call 450-452 or 453-TILE. Don't miss out on this incredible Christmas sale.
This is Radio Caribbean International. It's now time for the weather news.
And also, of course, the 1.1 is now time for your weather report as of 12 noon today, presented by Island Style Talent Bath. The forecast for St. Lucia Valley for the next 24 hours. The winds will be blowing from between the east, northeast, and east near 21 miles per hour or 33 kilometers per hour. The weather partly cloudy and breezy, becoming cloudy at times with some brief showers for the remainder of today. Tomorrow will be mostly cloudy with scattered showers. And there is an advisory in here which reads that small craft operators and sea beavers are advised to exercise caution due to brisk winds and locally rough seas. The forecast for the lesser entities, partly cloudy and breezy with scattered showers. And the weather summary, the Atlantic high pressure system will continue to generate moderate to brisk easterly winds. And locally rough seas across the Eastern Caribbean region during the next 2 days. Weak unstable conditions will cause occasional cloudy periods with showers over the lesser Antilles for the remainder of today, and also an increase in shower activity expected tomorrow as low-level trough traverses the region. And this was the weather report as of 12 noon today, presented by Island Style Talent Bath.
This has been RCI's Weather News. For more information, call the Weather Hotline at 454-3452. RCI 101 number 1.
Michael, where you going with all that speed?
Girl, I hear Island Style have a big Christmas sale, up to 50% off on all kind of tiles. Wall tiles, hexagon, subway, mosaics, and wood look tiles like you will see on HGTV.
You serious? I see they have a lot of new products too, like vinyl flooring, wall panels, ceiling tiles, even travertine to make your pool look top notch. That on sale too?
Yes, girl, it's everything store-wide. I see they have got cleaners and sealers too. Tell me, BSL, I need those for sure.
Hey, girl, that's not a biggie, but we heading to Island Style right now.
Visit Island Style Talent Bath now in Castries, Rodney Bay, and Viewfort. Find us on social media or call 450-452 or 453 Tile. Don't miss out on this incredible Christmas sale.
And welcome back to the Lunchroom here at Radio Caribbean International. Got about 13 minutes to go before the hour of 2 o'clock. And of course, we've been discussing health, the health sector here in St. Lucia, in particular, that of the phased opening of the Dr. Betty Wells Urban Polyclinic. It is to serve the Castries Basin, very important step in terms of primary healthcare for the city of Castries. And of course, Grosley has a polyclinic right now, Sufred Hospital, Denry Hospital sort of serve as polyclinics in their own right currently. And of course, the long-awaited equivalent for Castries is here, and it is the retrofitting and repurposing of the former Victoria Hospital in that way. We're speaking to Dr. Glensford Joseph, as well as Nurse Frederick Cassius, as well, to tell us, and they're telling us quite a bit, of course, about the rollout with respect to this facility. Now, of course, earlier on, Dr. Joseph made mention of the National Eye Clinic, and Nurse Frederick Cassius. Maybe you want to tell us a little bit more about the services, what is actually on offer within that National Eye Clinic.
Right. So as you said about retrofitting the spaces, it's very good that the public know that those services will now be offered in a new, comfortable, renewed space. So as we know it, the Cuban Eye Clinic was in its old location closer to where the wards used to be. So it is now within the National Eye Clinic. Is actually, let me just to indicate the space, it's where maternity ward used to be. So it's towards the front. As soon as you climb the ramp, it's right there to the front. So the National Eye Clinic, like Dr. Joseph has indicated, will comprise the Cuban Eye Clinic as we know it, and the diabetic retinopathy clinic that was offered at Castries and then moved over to Babono when Castries was closed. So those services will continue in this new site. I just want to zero in on the diabetic retinopathy. I always take the opportunity to say more about it because I think this is a service that is being underutilized right now, noting the number of diabetes cases that we have in St. Lucia. And this is a service that St. Lucians should access because, as we know, diabetes with poor sugar levels, uncontrolled levels, can affect any part of our bodies, including our eyes. So it's very important that all our diabetics have an eye exam annually, and in some cases even more frequently. So we do have equipment, new improved equipment within the eye clinic for retinal imaging, for diabetics, where they take a picture of the eye and grade it to see the damage, any damage of the retina, and to be able to and the treatment actually is the laser treatment. If the damage is very severe, then we also have available the laser treatment right in that space as well. Before, the client would have had to do the grading of the eye and then go to another location. So it's very good that we have all of those eye services in one location, and the clients can actually go back and forth between the Cuban Eye Clinic and the DR, as we call it, Diabetic Retinopathy Clinic, to get those services. In addition to that, of course, we know there is the routine examination of the eyes, refraction of the eyes to check for the pressure of the eyes as it relates to glaucoma. You can have your glasses prescription refill. You can have general medical refill. As one of the things that we want to do is to ensure that when a client walks into the facility, that we're not just looking at just the eye, but we look at the client as a whole. So you may come for an eye examination or to seek a follow-up for your eye. However, we will be taking your blood pressure, we'll be taking your blood sugar, we'll be taking your weight, we'll be taking your height. Yes. So we're looking at the client as a whole. So you may come for your eye, but when you leave there, you will kind of know, your health status by doing all of those measurements. There will also be health teaching, there will be counseling. There is also going to be mental health services available. So all of that will be available at the eye clinic. I just also want to indicate in terms of the flow of the clinic. As it stands now, the client would have just walked in, seen the doctor, get the drops, and go out. But now we want to ensure that, first of all, that all clients who walk into this facility will be registered into our health information system. So we want to encourage clients to walk with their IDs to ensure that we have the right or the correct information on them to enter into the system. In addition to that, like I said, you go to another area where your blood pressure, your weight, your height, all of that will be done for you. Then you will be able to go in now to see the doctor for the various services. So all of those services are available in one spot. And right now we have a walk-in system, but what we want to do is to encourage clients to call for an appointment, which can reduce the wait time at the facility. I'm sure when you go around, you go to the health facilities, you see everybody there in the morning, from 8 o'clock, 5 o'clock sometimes. Everybody. You pass that at a health center, and everybody is there at 6 o'clock, at 7 o'clock, to see the physician or to get the healthcare needed. So what we want to do is to reduce wait time at the facility, because we understand that this is one of the areas that probably reduce persons from accessing care, because everybody is busy. Persons are at work. We have working mothers. We have the men in particular. They don't like the wait time. So we want persons to be able to call to make an appointment. We really want to introduce the appointment system at the eye clinic to reduce wait, and persons are able to also get the quality of healthcare that they deserve. So again, St. Lucians, we want to encourage you to call. We will be giving you the numbers, and it will be circulating as well as to which number to call to make an appointment, whether it is just have a general eye exam, whether it is to come in to get some health education on diabetes, whether it is to check your eye for diabetic retinopathy if you are diabetic. So it's a whole range to get your glasses. So it's a whole range of services that will be offered at the new and improved National Eye Clinic.
Fantastic. So it definitely sounds like we've been waiting for a while for this, and it is finally happening indeed. Dr. Joseph, as well, Ms. Cassie sort of placed us in terms of the National Eye Clinic. You're speaking about the urban polyclinic as well. How is that? Is that where we used to think of as A&E? Where is it situated in terms of the old Victoria, which is, of course, a massive facility?
Okay. When we speak to the Dr. Betty Wells Urban Polyclinic, the space of utilization
significant. Yes, please.
Yes. When we speak to the Dr. Betty Wells Urban Polyclinic, the space of utilization is quite significant. As nurse has explained to you, with just the National Eye Clinic, when you get into that space, you are going to be wow. You know, as you see the ambience, the space that is being utilized for the various services, you know, you're not really compressed as you were when you attended the Castries Wellness Center. The urban polyclinic is going to be utilizing that whole accident and emergency area that we knew of in the past, as well as what we call the Francois Dolto building. I mean, for some, they may not be familiar with the name, but where you've had the entire maternity suite upstairs, that floor down below, I think the medical, as well as where you once had the physical therapy department, all that space will be utilized for the urban polyclinic. One important thing to note as we speak to the urgent care, person may be of the notion that, okay, then I'm going into the accident and emergency that used to be at Victoria Hospital. This will come in the second phase, because in this first phase, the location that we are using will not be in the former accident and emergency space at Victoria. And you will be guided, you wouldn't get lost. Once you get to the gate, there will be signage to guide you to the space that will provide the medical, urgent care, as well as pharmacy services. And there are going to be signage to guide you towards the National Eye Clinic. So you wouldn't get lost, and there will be persons, the security guards, patient welfare officers that are going to guide you so persons wouldn't get lost. But just to note that as we move into the second phase in 2025, we are definitely going to relocate the medical and urgent care service from where they would have been, from the space they would have been provided in phase one, into their final position where they're going to be from the start of phase two onwards, which would be our accident and emergency. So when you come for urgent care, you will be going into that, but that, of course, is phase two. But also when we get into phase two, we will be bringing the services that used to be at Castries Wellness Center that were redistributed to other wellness centers because of the needed closure of Castries. For instance, the sexual and reproductive health that was transferred to the Cicero Wellness Center, the dermatology clinic that was transferred to the Grosley Polyclinic. You have maternal child health and other services that were transferred to other facilities. So all these primary care services that you used to be having at the Castries Wellness Center will now be under the roof of Dr. Betty Wells Urban Polyclinic. As indicated, antenatal, postnatal, you know, the pregnant mothers, the maternal and child health services, sexual reproductive, mental health services, and more so we are moving towards strengthening our community mental health services. And as such, Castries Wellness Center will be a good base, even though the program will be island-wide. We do note that when we look at St. Lucia's health profile, cancers of the breast for women, prostate for the men, are the leading causes of death among our population. And as such, while we do have cancer screening across the island, we're going to have a well-established service at the Dr. Betty Wells Urban Polyclinic that persons can access. Because we note that while our St. Lucian population, about 20% or 20 to 30% of our population resides in the Castries Basin, we know there is a decline, right? Because 2010, there was about almost 30% of the population in Castries. So while there has been a decline based on our 2022 census for somewhat 7.7%, bringing us down to about 20%, 20.9%, we still note that there's a significant population and also the utilization. When we looked at then Castries Wellness Center, we would have had persons coming all the way from Viewfort, Dennery, all areas of the country accessing services there. And I can anticipate that when the Dr. Betty Wells is fully established, we are going to have significant utilization. And so we want to ensure that these services are there. We're going to be looking also at the men's clinic, which we are revitalizing at this point, will be established so that the men can come in. And as you note, we'll be having services beyond 4 o'clock. So when you leave your job, you can come in not only because you're sick, because we're not only looking to manage the sick, but our overall well-being. To have a wellness check, you'll have an opportunity to come in. You did mention the dental services, which was not present within the Castries Basin. Well, at the Castries Wellness Center, we do have at La Clery some services there, but in Castries proper, we're going to be having some dental services, a dental clinic with the necessary operation at the Dr. Betty Wells Urban Polyclinic. There will also be health education to encourage persons, when they come in, it's not just to attend to the various clinics, but you have an opportunity to go into the health education component and be educated about your illness, educated about wellness. There will be the nutrition aspect where we are preparing to have things like demonstration area that, yes, you're going to be educated, but they have the capacity to demonstrate how you can prepare certain nutritious foods with what we have, especially if you're impacted with diabetes, hypertension. And physical activity will also be another component that will be integrated into the Dr. Betty Wells Urban Polyclinic. We do note that while all these services will be very good for the population, there are times when we will need to have specialist clinics. We will have some specialist clinics like internists. Across the island, we have been able to establish a medical internist clinic, which is going well. And such a clinic will be at this facility. And there are instances where we have external consultants, specialists, coming in to provide services in St. Lucia. That too will be a base through which such services can be delivered. So we're looking at, as I said, an urban polyclinic, second to none, one that you're going to be marveled at. Just be patient, allow us to work through the various phases. What you're going to be exposed to by the 16th will not be the final product, but we are really trying to alleviate the pressures of Castries. We do note the pressures that the staff and patients are being exposed to when they go to the La Clery, which is very small, and having to deal with an increasing number of persons who used to be accessing the Castries Wellness Center. We're trying to alleviate those pressures. Also, to really get persons who should not be going to the Owen King European Hospital emergency room. Those, when we talk about our emergency severity index, when we do the triage, I mean, the general population will not know this, but as indicated, depending on how you feel, if you feel like you're imminent death, severe shortness of breath, severe chest pain, difficulty in your changes in your mental state. Those are the cases, yes, you go to the Millennium Heights. And as I said, we're going to have forward educational program to sensitize the people about how best to utilize the two services. But at the Dr. Betty Wells, we're looking for the urgent because we're having an urgent care service, and we're going to have physicians capable of managing. These are physicians who are ER trained, internal medicine trained, that will be working in that environment. So we are going to be delivering a very good suite of services to the Castries and environs, and anyone else from the rest of the country who want to benefit from those top of the line services that we will be delivering in this upgraded and new Dr. Betty Wells Urban Polyclinic under our Dr. Winston Paris Medical Complex.
Well, fantastic news, no doubt, for a lot of individuals who need to access healthcare. And we are thanking you, of course, for sharing with us, Dr. Glensford Joseph, as well as Nurse Julietta Frederick Cassius, about what's happening over at the Dr. Betty Wells Urban Polyclinic. And of course, lots to take in. No doubt lots of people will be looking to this facility, of course, as it launches and goes through the current period. You wanted to point out something very quickly?
Very quickly. Most important, I know St. Lucians love the eye surgeries. They wanted to access the eye surgery, so I forgot this one. So the eye surgeries, though we have the general eye services happening now, however, for cataract anti-pterygium surgeries, we are going to commence in January, but clients will be called to be reassessed as the weeks go by. So St. Lucians lookout surgeries will be back in January.
Okay, also very fantastic news. You guys have come bearing lots of gifts today. It's actually the Feast of St. Nicholas, so maybe that's why. But thanks again, wonderful news indeed. And we're thanking Dr. Glensford Joseph, as well as Ms. Julietta Frederick Cassius of the Ministry of Health, telling us about the rollout. Sort of a soft launch, but speeding up very, very quickly to bring lots of services at the Dr. Betty Wells Urban Polyclinic right in the city of Castries. Certainly, thank you very much for that. And of course, this is our program for the week. I just want to send out a bit of a shout out to the students who came to St. Lucia to mark, well, they were the best in the region really at the 2024 CXC, CSEC, and CAPE examinations, and they were here last night for a ceremony which happened at the National Cultural Center. So we do want to congratulate them on their wonderful, wonderful performance. The two top students coming from Queen's College, Guyana, and their names, Anaya Couchman, she was a top CAPE student, as well as Dave Chowty, a top CSEC student. And they both did, I think, something like around 20 subjects for CAPE, I mean, and CSEC. So remarkable achievements for them, and to all those who came from around the Caribbean to be recognized by CXC. We just wish them the very best. And of course, that's our program for the week. We do hope that you can join us next week again. We should be on, I think. We'll see. It is going to be our last week if we actually are on. And of course, we do wish you a wonderful season in advance. I'm your host, Alex George Jr., saying goodbye.